I mean, we see a lot of kids and pregnant women in the office, but I just wanted to have more tools to be able to handle the different situations that were coming in. Taking care of kids isn't just like scaling down the adjustment. It's looking at them for like what their, how their system is running as a child is very different than as an adult. Their structure isn't set yet. So like if they're babies, then they're not, like their bones aren't yet ossified. So you're not really delivering the same type of thrust through a joint. There's different motions that you do and you don't do with babies. There's different moves that you do and don't do with pregnancy too. Natural as birth is, it can be traumatic. Things don't always go smoothly through pregnancy or through delivery. I mean, there's still cases of emergency C-sections and children being, helping them be delivered through forceps or vacuum extraction, or sometimes they get stuck and more force is transferred through the baby's head and neck. We've had cases of children that had the cord wrapped around their neck. So these are traumas that the baby is born with. So you want to try to address those traumas before they develop into more serious issues. If your nervous system is choked off at the cord at the very top, it can affect almost anything. But a lot of times, if there is nervous system pressure, the things that babies might present with is they may be colicky. They may have, digestive issues. They may have reflux. They may be constipated. When babies come out, they'll have a head tilt, which you'll hear the term torticollis. Like that's not common, but one of the things that can happen if there's pressure, there's neurological pressure. The statistic that I read was that 1 in 7 women suffer from postpartum depression, and that can happen as soon as 38 weeks into their pregnancy, and it can last for up to 2 years after pregnancy. You're kind of stuck in a loop at that point. If you're still pregnant and you're exhibiting signs of postpartum, then typically if you recognize it and you tell your OB, then you get referred to a psychiatrist. But there's only so much a psychiatrist can do because you're pregnant. They end up kind of bringing you back to the OB because there's not a lot that they can do while you're pregnant. They're not going to put you on meds while you're 38 weeks or while you're breastfeeding, or so they get stuck in between, like in flux between the OB and the psychiatrist until they kind of get lost in those few years. So there's really nobody to help them during that time. Women get pregnant, we're treated kind of like we're sick, from the time that we get pregnant until the time we have the baby. It's like, well, you can't do this, you can't eat this, you can't have this. At this point, we got to test you for this, and this, and then we got to rule out this, and this, and then we're, and there's always, this, like these things that you kind of are worried about as a mother, that is something going to go wrong constantly. Like, so you're kind of, kind of stuck in this like kind of a sympathetic state of like nervousness or like fear, that like you want to make sure your baby's healthy, and every time you go in, like you're getting tested for something that could be wrong or could, so we're kind of on guard all the time, and that sometimes stimulates that stress response of that fight or flight or that sympathetic response. So when in reality, like we really want to be in a more relaxed state, when we're pregnant, because that's a more calming and soothing environment for the baby. That's one of the things that we try to focus on, is kind of maintaining that balance, getting that balance back. There's a need to be in sympathetic. There's a need to be in parasympathetic, but we kind of get into this overdrive when we're pregnant because of the stresses that are put on us as expecting mothers. If your system has less stress on it, the nervous system is less stressed, then hopefully that will transfer over to the baby too. So the baby will be in a less stressful environment.